What's up, y'all? It is Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer gynecology to women and adolescents, as well as total wellness solutions, including hormone pellet therapy, weight management, intimacy services, total wellness solutions with supplements, as well as laser hair removal for both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. So I get a question a lot of times about how do you know whether you're in menopause and what is this whole perimenopausal thing? So let's talk a little bit about perimenopause. So the way I explain perimenopause is that when you're talking about perimenopause, you're dealing with the testosterone hormone for women. When you're talking about menopause, you're talking more about the loss of estrogen. So the first hormone to start to deplete that really affects how you feel and many of the symptoms associated with menopause would be testosterone. Testosterone is the forgotten female hormone and it's the anti-aging hormone. Those are the two names that I call it. And I call it the forgotten female hormone because when everybody thinks of women, they think of estrogen and progesterone. And when they think of men, they think of testosterone. But women have always had, when you are born and as you grow up and go through adolescence, you're going to produce a certain amount of testosterone. Now, granted, it's way lower than what men actually produce, but you still produce testosterone. When your testosterone starts to decline, which can be caused by age, it can be caused by hormonal birth control because that naturally suppresses testosterone. It can be caused by illnesses. It can be caused by so many different things. But many times it's just the aging process. Testosterone declines. That's usually in the late 30s to 40s. And perimenopause can go on for well over 10 years. So perimenopause is when your testosterone levels start to decline, and many of the symptoms associated with that include fatigue, joint pain, weight gain, and especially belly fat, mood changes, mind fog, problems with sleep, low libido, decreased enjoyment of intercourse, and decreased sensitivity, as well as night sweats. So all of those symptoms are associated with low testosterone. And what usually happens is that the symptoms come on so gradually that you don't even recognize it. So you may notice that you're waking up every now and then in the middle of the night and you have a night sweat hither and thither. It's not like all the time, so it's not affecting your quality of life. You may notice that you're not really initiating intercourse like you used to, and you don't really think about it as much. But then you notice that you're tired. You're like, why am I tired in the middle of the day and I slept last night? You start to notice that you feel like you're getting adult ADD, as well as noticing some changes in your mood, like irritability, anxiety, or depression. So all of those are signs that your testosterone levels are starting to decline. And again, everybody doesn't have significant symptoms, but for those people who do, and it's starting to affect your quality of life, when your testosterone levels are low and causing these symptoms, all we do is replace testosterone. And we can do that a couple different ways. We can replace testosterone by my favorite way, which is a plant-based bioidentical testosterone hormone pellet. And the other way is with plant-based bioidentical testosterone cream. I prefer the pellets because they're individualized and customized for each person. So we're going to dose you based on your weight. We're going to dose you based on your BMI. We're going to dose you based on your history of activity. So if you're like an athlete all the way through college, your dose would be different from somebody who's never been active or played sports. And we're going to also dose you based on your activity now and, of course, your lab work. So once I put all those things together, get a good history from you, figure out, whether you're already having signs and symptoms of low testosterone, which also include acne. So a lot of women will start to notice this adult acne, and that's a sign that your testosterone is declining. And a lot of women will also notice hair growth on the face. So that is another sign that your testosterone is declining. So when these symptoms are an issue, come in and see me. Let's do a hormone consult. We can do that through your insurance, or you can do that if you already know you're going to get a pellet. It's better to just go ahead and do the consult because that'll save you a copay and a visit. And then I get your blood work. We come up with the plan to see how you want to be treated. And I think the biggest deal about the testosterone replacement is, like for me, for example, I didn't even know I had a testosterone problem. I only had my levels checked because I was going for training so I can treat my patients when I was 38, not knowing that I was having those problems myself. And then I got my pellet when I went to training and realized how much it changed my life. Testosterone also reduces your risk of heart disease, breast cancer, dementia, and bone loss. So definitely some health benefits. It also helps with patients who are diabetic because you don't gain as much weight in your belly. It's easier to lose the weight. It's easier to control your appetite because you don't have as much emotional eating. And you hold on to muscle, which helps with metabolism and makes it easier for you to lose weight and keep the weight off. So testosterone has a lot of benefits for women, even though we don't have nearly as much as men. The amount that we have when we're young, when that starts to decline, can negatively impact our quality of life. So replacing it not only helps with your quality of life, but also improves your health. So we recommend testosterone replacement for those women who are suffering with the symptoms I just described, who are miserable, and who want to improve their quality of life. So it's Dr. Mia and Me Bella Wellness Center. If you're noticing these symptoms, just give us a call, schedule your appointment so we can figure out exactly what's going on. When we get that lab work, we don't only get hormone levels, we get thyroid levels, we get your electrolytes, your kidney function, your liver function. We get vitamin levels as well, because many of these things all mimic each other. So we want to make sure we're treating the right thing. And it's so easy to treat the problem instead of giving you a bunch of medications, like something to help you sleep, something to possibly help with your night sweats, something to help with your weight loss. You end up on all these medicines and all you need is some good, healthy, plant-based bioidentical testosterone replacement. So give us a call. If you need to schedule your appointment, you can even go online to mebellawellness.com and make sure y'all join the Ageless Bells and Bows with Dr. Mia and Joseph Facebook group, because that's where I'm going to start doing more of my Facebook lives and giving more information and having it open for discussion. So make sure you join that group because it's going to be great information. That's for men and women. It won't only be focused on women. It will also be focused on men. So it's Dr. Mia at Me Bella Wellness Center. Thank you for tuning in. I hope you have a fabulous day. I'll see you tomorrow. Bye.